So this is an app from the CNIB that simulates how glaucoma can affect your visual field. And we show clients this so that they can see the effects of not taking their medication.
Meet Sharon Peters, a low vision specialist with the CNIB. Sharon has glaucoma, an eye disease that she shares with her father and two of her sisters. Glaucoma is a group of eye diseases that present no symptoms and can eventually cause blindness. Worldwide, it is the second most common cause of blindness, just behind cataracts. Dr. William Yalakovic, an optometrist with Harborview Optometry, screens every patient he sees for glaucoma.
We all have regular pressure within our eyes, like we have normal blood pressure. And if the pressure within your eye becomes elevated, that often leads to damage within the eye, and that's kind of what glaucoma is all about. Fortunately, although there's no cure for glaucoma, there is good treatment. And the standard of treatment for most patients with the most common type of glaucoma is to start them on an eye drop every day that they instill usually before bedtime, and that helps to reduce their intraocular pressure.
People with glaucoma are usually over the age of 40. It is a chronic disease with no symptoms. For Dr. Yalakovic, this makes it difficult to encourage patients to get screened.
Glaucoma is very easy to be checked for. The worst thing that could happen is the dreaded eye puff in your eye that most patients know of when they come in. But that screens the pressure in your eye, and so that's really the first and easy step to seeing if there's any concern with elevated pressure in someone's eye.
Once a patient has been diagnosed with glaucoma and a treatment plan has been established, the CNIB plays a big role in the maintaining of that plan and helping with any visual impairment.
When someone comes to the CNIB after they've been diagnosed with a glaucoma, one of the main things that we want to do is make sure they understand the disease and how it affects their vision, or how it can affect their vision. We show them through simulation what can happen to their peripheral field, because sometimes you don't really understand it by just saying you'll lose your side vision. So we do show them under simulation what that's like. We want to make sure that they take their eye drops, so we tell them how important it is that they're compliant with their medication.
For Sharon Peters, being involved with the CNIB has given her the ability to know more about the disease that has affected her and her family, and to help those who are suffering with it as well.
It has affected my life because my father is blind. He lost his vision to not only glaucoma, but macular degeneration as well. So for me to be able to give back to people, to try and make them understand the importance and the significance of their regular checkups and knowing their history, knowing what they can do for their eye health.
Glaucoma is often a hereditary disease, so knowing your family history is very important. But the best way to protect your eyesight is to see your optometrist and have regular eye exams.
Glaucoma is often referred to as the silent thief of sight because it kind of sneaks up on people.
The month of March has been dedicated to World Glaucoma Awareness, and optometrists everywhere are encouraging people to come in for a regular screening. For Go Thunder Bay, I'm Janice Gummison.
Back of your eye, and this is the optic nerve that we're concerned about because that's where the damage occurs with glaucoma. Once we've taken the